Welcome to Sketchy. We take all the super complex stuff you need to learn and turn them into memorable visual stories packed full of everything you need to know on test day. Click the link in the corner or description to try for free for 7 days. Now let's get to it.
In this video, we're going to whip through the most common causes of post-renal acute kidney injury. So we're here at the fire station where our hapless rookies have been hit with a plague of hose blockages. Basically, if urine flow is obstructed, it backs up against the glomerulus and thus slows the filtration rate, causing a rise in creatinine. Once you relieve the obstruction, the AKI should resolve as well. So urologists are really just glorified plumbers. Let's go from the bottom up, since the most common cause of post-renal AKI happens at the urethra. With urethral blockage, the patient will present with lower urinary tract symptoms like hesitancy, urgency, nocturia, weak stream, or worst case scenario, no stream. So first, palpate the bladder. A distended bladder, symbolized by this water cooler, will feel like a miniature bounce house has been installed in the patient's pelvis. Usually this is enough to warrant a bladder catheter, like the one you see inserted into our water cooler. But if you're in a fancy academic center, you may get a bedside bladder scan to estimate the bladder volume. But FYI, its accuracy is affected by things like body habitus, tissue edema, scarring, or the patient taking a swing at you as you press down on their exploding bladder with a cold glop-covered wand. If urine hits the ceiling out of a straight cath or completely fills a Foley bag in 6 seconds, then you've diagnosed and treated a urethral obstruction. The AKI will now magically resolve, making you a long, skinny tube-wielding hero. Obviously, the urologist will get the ultimate glory when they definitively treat whatever was causing the obstruction. So what are those causes? Let's start with mechanical obstructions. The most common cause is Captain Prostate choking the urethra, aka benign prostatic hypertrophy. Other causes include any cancer, represented as always by the cancer crab, that lives in the neighborhood, including prostate, bladder, uterine, cervical, and of course urothelial cancer in the urethra itself. Sticks and stones, or blood clots and kidney stones, can also get lodged in the bladder outlet or urethra. This hose is taped up way too tightly to represent stricture of the urethra. It's more common in penises and is usually idiopathic, but can also be due to trauma, infections, and radiation. But uteruses also want to get in on the action, so let this tired, fallen backpack remind you to consider pelvic prolapse as a cause.